60-year-old man, chest pain after meals, cardiology workup normal. What's sitting behind his heart? Hiatal hernia. So this 60-year-old obese individual presents with post-meal fullness, recurrent reflux, occasional dysphagia, one episode of severe retching followed by chest pain. Chest X-ray shows a gas bubble behind the heart with fluid level. See that gas bubble in the lower mediastinum? That's your hiatal hernia. So what went wrong here? Normally, the anti-reflux barrier has four parts: the lower esophageal sphincter, the crura of the diaphragm, 2 to 3 centimeters of the intra-abdominal esophagus, and angle of His, which is an acute angle formed by the left edge of the esophagus and the fundus of the stomach. In conditions like congenital weakness, trauma, increased abdominal pressure, and advanced age, the hiatus widens, the phrenoesophageal membrane stretches, and the stomach herniates into the thorax. There are four types of hiatal hernias. Type 1, sliding hiatal hernia, where the gastroesophageal junction slides upwards. Type 2 is the paraesophageal hernia, where the gastroesophageal junction is in the normal position but the fundus of the stomach herniates into the thorax. Type 3 is mixed with both sliding as well as paraesophageal hernias. Type 4 is a condition where the stomach along with organs like spleen and colon herniate into the thorax. Type 2, Type 3, Type 4 hiatal hernias can strangulate. When a patient with hiatal hernia presents with sudden severe chest pain, retching, and inability to pass the NG tube, it constitutes the Bouchard's triad, which is the typical feature of gastric volvulus seen in a paraesophageal hernia. The hernia can be demonstrated as a gas bubble with fluid level behind the heart on a chest X-ray. However, CT with oral contrast is the investigation of choice, which will not only show the anatomy of the stomach, it will also tell us about the other organs involved in the hernia. Treatment: Type 1 hiatal hernias are treated with anti-reflux medications, that is PPIs, head and elevation while sleeping, and weight loss. For Type 2, that is paraesophageal hernias, the treatment is surgery. During surgery, the anti-reflux barrier components are all restored. That is, first, the hernial sac is reduced from the thoracic cavity into the abdominal cavity. The distal part of the esophagus is mobilized to achieve the 2 to 3 centimeters that is required for the intra-abdominal length of the esophagus. The hiatus is narrowed by suturing the crura together. An anti-reflux surgery like Nissen's fundoplication is performed, and the entire repair is strengthened by placing a mesh at the hiatus. So next time you see a gas bubble behind the heart, don't just think lung, think hiatus hernia. For more such concepts made easy, follow the surgical mind.